Thank you for being here today for our August Choices Community of Practice coffee chat. The topic for today's event is putting the eggs in all the right baskets, tips for braiding and layering funds to support public health programs. My name is Molly Garrone, and I am a Senior Communications Coordinator for the Choices Project at the Prevention Research Center on Nutrition and Physical Activity at the Harvard T.H. Chan School of Public Health, and I am happy to be facilitating today's event, as always. I would like to acknowledge our funders who make this work possible and share that our Choices work and events are only for research and educational purposes. The intention of today's coffee chat is to provide information, tools, and resources to inform and educate, and we are not looking to influence any specific legislation. I also want to note that our guest speaker today has been invited to share personal perspectives and does not speak on behalf of Harvard. If you are unfamiliar with the Choices Community of Practice, we are a network that includes people whose work focuses on advancing obesity prevention, healthy eating, and active living, and want to learn more about how cost-effectiveness analysis can advance their efforts and address health equity. Our coffee chats are unique opportunities to share ideas and enhance connections in an informal setting. Today, we will start by hearing a presentation from our speaker, and then we will open up the floor for a full group discussion and Q&A. And we really encourage you all to share questions or comments in the chat or think about what you might want to ask during our full group discussion at any time throughout the event today. For today's coffee chat, our guest speaker will be discussing braiding and layering funding to support public health initiatives, and she will be detailing some specific examples. So we're really excited to be joined by Maffey. Ali is the Vice President of Social and Behavioral Health with the Association of State and Territorial Health Officials, also known as ASTO. The Social and Behavioral Health team advances equity through the prevention of injuries, suicide, firearm violence, adverse childhood experiences, and overdoses. Ali came to this role in 2023 after 10 years with the Injury and Violence Prevention Branch at the Colorado State Health Department. There, Ali provided branch-wide leadership, oversaw the statewide youth health survey, and launched multiple substance misuse prevention programs using shared risk and protective factor approach. Ali also worked for 5 years with national policy advancement nonprofits and 3 years in local public health. So without further ado, I'm going to pass it over to Ali for your presentation.
All right. Thank you so much, Molly. Really appreciate it. And I'm so happy to be with you all today. So if you don't mind advancing to the next slide and then one more. A little bit about ASTHO and who we are. ASTHO is the Association of State and Territorial Health Officials, and we represent the 59 key leadership positions across state or territorial or freely associated state health agencies. And our primary functions are to develop strong and effective public health leaders, improve public health through capacity building, and advocate for the resources necessary to do public health well across the country. Next slide, please. So our objectives as we're talking today, it's perfect that many of you are looking forward to learning because that gets to be our goal today. So as a result of our discussion, I am hoping that you'll be able to define braiding and layering and how it can be used to support programs and services, identify some examples of those experiences and successful efforts, some pitfalls to avoid, and then consider the necessary steps for what you might do to take this back as you're learning more. Next slide, please. So what is braiding and layering of funds? Essentially, what we are talking about is the ability to combine funding from various sources to be able to put it towards one public health effort or achieve one common goal that we might have. So it helps to achieve economies of scale by funding comprehensive services. It can strengthen some of the infrastructure, break down internal silos, increase collaboration, and enhance the impact of addressing health disparities. So very often, some of those specific public health efforts that could achieve multiple goals are actually those social determinants of health and the ways that we can address health equity across multiple topics. So you heard in my introduction that my background is injury, suicide, violence, overdoses, cannabis misuse. All of those things are where my heart and my experience lies. However, many of the strategies are very similar to or rely on some of the topics that you all know best. Adverse childhood experiences include poor access to nutrition and being malnourished as a child. An adverse childhood experience is exposure to community violence, and we know that built environment can really impact the experiences of community violence that people have. And so our work is really interrelated. I might not speak your language as well as you do, but it's really connected. So I'm looking forward as we explore those together. Next slide. So let's dive into each of these things. I'm going to be honest, I am not an academic. So there's a specific language about braiding, there's specific definitions for layering. The distinction between the two is less important to me. I'm not an academic by background. What is really important is you don't want to use the term blended funding. Most of our grantors, legislators, whomever gives the money that we use to do the work that we do in public health, when you say blended, you set off red flags because they start to think that the money goes into this pot and dissipates, and now there's zero accountability for where those funds went, that they all got blended, and I can't report back or have accountability and responsibility for the funding that I used from that funder. So avoid the word blended. I am going to give you the definitions between braided and layered. So braided is really that you have multiple funding sources and you might put it all together into one single contract or one single initiative. So multiple sources paying for one contract or one community initiative. And that's the braiding. There's still, when you think about a braid, there's still the individual accountability and reporting capacity for each of those braided pieces of funds. They still maintain their distinct boundaries of what that fund is doing and your ability to report on it. But it's going into one effort, one braid. So program reporting does incorporate the requirements of each of those streams. Then you might need to know what each funding stream needs to report back on to their funder, but you can collaborate it into one initiative. Next slide. Let's look at layered funding. So again, you have that same collaboratively determined goals driving it, and you have multiple funding sources, but everyone might kind of maintain control of their own funds still. You're not putting it into one initiative, but you're actually saying, you know what, I'll pay for the facilitator, and you pay for the space, and you pay for the materials. So you don't need to necessarily combine funds, but you can separate the funding to different activities that still get you toward that collaboratively determined goal. So braiding and layering, oftentimes for projects, you're doing both. You have some resources that you're braiding together. You have other resources that you're layering and saying, you know what, I'll pay for activity 1 and 2 and you do 3. Braiding and layering can also look like, and people use different terminology interchangeably for this, but I'll pay for this one intervention in these counties and you pay for it in those counties. So is that braided because you're paying for the same intervention and you're just keeping it kind of separate where it is? Or is that layered because you're layering up? This is where the distinctions are less important to me, and academics can argue about them, but essentially we're still achieving the same goal. We are using funding from multiple sources to achieve those collaboratively determined goals together in whatever way works best for the type of funding sources we have and the burden that we may have to make those funds work together. So the next slide. ASTHO did a variety of research and interviews with partners to be able to learn a little bit more about what braiding and layering requires to be successful in jurisdictions. And the first one is leadership. You need active engagement and buy-in from leadership on that shared vision and identifying who is leading that braided or layered work. You need assessment and prioritization. In order to get to those collaboratively determined goals, there needs to be a process of assessing what is needed most and prioritizing which one should be what we're putting our funds together towards. There needs to be really specific conversations about the methods. What funding streams actually have allowable expenditures in this way? What is their cost allocation process? What even is their funding timeline? If you're working on braiding funds and some end June 30th and some end July 30th, you really have to think about how you're using those funds well in a single contract. Management is really the hands-on dedicated FTE required to really be focused on those expenditures, outcomes, problem solving, making sure the data is being collected, making sure we didn't lose the accountability for each piece, the timeline, the methods for each piece along the way. So you really need that hands-on management experience. And then value, really braiding and layering has to achieve anticipated results that will be of value to funders, policymakers, whomever it may be, across each of those sources. So with that, let's dive into a couple examples. Next slide. Oh, this is the research where that came from. We'll drop a link to that published article after this. Next slide. All right, so we're going to talk about prioritization, the leadership and assessment and prioritization of those common goals in 4 areas. So leadership needs to decide this is what we're doing. We want to work on this together, and we're going to bring the potential funding sources together to talk about how we will share funds towards this common effort. What is that effort we want to fund? First, we're going to talk about is a shared infrastructure. Second is an agreed upon strategy. We're all doing the same thing in different places, maybe. An agreed upon objective. We're all trying to move a certain needle, but we might move that needle in different ways. An agreed upon theme or category. We all want to achieve one big, broad health outcome, and we're all doing it in really different ways. So those are the 4 ways we're going to talk about braiding and layering. Next slide. All right, so which common goal are you funding? This is where we start to talk about the eggs and baskets. So if infrastructure is what we're talking about, we're going to talk about how strong is our basket, each of our baskets. Do we all have a good, ready basket, ready to take on this work? This is where multiple programs identify a shared need. Is there a technology need that we all have across all of our different programs? We might be doing really different strategies, really different outcomes, but we all have a shared need for that technology, that training, that staff expertise. An example might be that coalition members, they might braid funding or trade funding. I'll buy software if you fund more of that training event for people. So that's your infrastructure. And your coalition can be internal, external. When it says here coalition, it could be within your agency, could be cross agencies. So the next one is a shared strategy. So you're going to put all the eggs into one basket. Our basket is one intervention, and we're all throwing our money into that same intervention. So coalition members agreed on that single program or policy that we're trying to pass, and they often braid their funding to get that fully resourced for implementation. Next slide. Oh, that one got stretched a little funny. My apologies. So in this one, the specific objectives, everyone has the same eggs, but they keep it in their own baskets. And so think about this of that layered example that some people think of as braided, some people think of as layered. Everyone's agreeing on on the same indicator that they want to work on to impact, but potentially through different settings or different avenues. So they might braid, but they typically layer. So that's one specific objective you might want to change, is that like increased youth access to a trusted adult in their lives who can talk to them about their health behaviors. And everyone might take that on in a different way, but you're trying to move that singular needle on the number of youth that report that trusted adult in their lives. And then the last one is the category. And this is where, and this is like the bottom half of the pictures there. This is where it's all the eggs, it's all the chicks, it's all the baskets, whatever. We're just talking hens. We're all kind of in the general theme. So the coalition members might agree on changing one layer of the social ecological model or one theme of factors. And coalition members might loosely layer funding, or everyone just retains their own and they're all putting it towards different activities that reach that common goal. All of these are braiding and layering. All of these are effective ways to reach some of those efficiencies that we talked about at the beginning and the opportunities of braiding and layering. All of these still require really good leadership, prioritization, coming to a common goal, understanding the limitations of funds and where they can work together, and understanding everyone's unique outcomes to make sure you don't lose that accountability along the way. So next slide, let's dive into these a little bit more specifically. All right, so here's one goal across all four. So a common goal is to improve. Oh, we lost our slides. Sorry, everybody. There we go. So a common goal is to improve school health. So if you wanted to work on on a shared infrastructure, all of us could benefit. One idea would be we could all benefit from one single staff person who best understands and builds relationships with all the different schools and districts in our area. When I was in local public health, we were in a county that had 17 different school districts, 17 in one county. And so what we ended up doing was all putting in money towards one shared FTE who was working to build the relationships that our local health department could be a resource to them when time for YRBS came up, when time for suicide prevention trainings, that's what I was working on, or drunk driving prevention strategies in schools, that's what I was working on, or healthy meals, whatever it might be, that we needed that one point of contact that had those relationships across all 17 because it was too hard for each of our programs individually to be managing. So that's an infrastructure example. A strategy example might be life skills training. Life skills training in middle schools is evidence-based to prevent substance use, criminal behavior, sexual risk behaviors, STIs, and violence. And so we could say, you know what, I care about violence prevention. You care about substance use prevention. You're trying to reduce criminal behavior and recidivism. You're trying to prevent teen pregnancy. But this one intervention helps us each achieve our individual outcomes. So let's all fund that one intervention together, whether it's through you pay for it in some schools and I'll pay for it in other schools, or whether we actually braid it into one contract. So you give me your STI money, you give me your violence money, you give me your substance use money, and I do one contract with the schools to do life skills training. So that would be a strategy. An agreed upon objective would be, we all know health education could really improve in our schools. And so we all want to make sure it's happening at different levels. We didn't all choose the same curriculum. We're just trying to make sure better health education is happening at the elementary school level, at the middle school level, at the high school level, with parents, whatever it might be. And then the last one is the theme or category. We want health education to improve in our county. And so we all might approach that in different ways. Some of us are going to do it through parent education directly. Some are going to do it through peer-to-peer education. Some are going to focus on school curricula. Some are going to improve pediatrician conversations with families. And some are going to work on community norms campaigns. But we're all braiding and layering our funds towards this big theme or objective. All right. So that's one set of examples. Let's dive in one more time just to drive it home a little bit more of thinking about how braiding and layering shows up in these four areas. So next slide. Tying it a little bit more to the work that you all do with nutrition, the shared infrastructure, really thinking about what we need to do the work well. Do you have the right supports in place? And so community health workers are a great example of that shared infrastructure. Some people might want to fund community health workers to be able to do immunization outreach. Some people might want to do it for more postpartum support and care. Some people might want to fund community health workers for diabetes management, but we all need that infrastructure in our communities of a strong community health worker workforce. And so we're going to put our money together for the CHWs. So that's an infrastructure example. Next slide. An agreed upon strategy. So in the state of Colorado, this is one that we did of working on improved conversations with between parents and teenagers around any of the hard topics. Our vaping campaign looked exactly like our cannabis campaign, which looked like our tobacco campaign, which looked like our sexual health campaign. All of them trying to get parents to have specific conversations with their youth. But then here we are fighting each other for ad space and ad time. And instead, we pulled the funds together and had one campaign about improving adult conversations with youth about hard topics. Because if you can talk to them about their sexual identity, you can talk to them about their mental health. And so it was really kind of backing in from like the hardest topics into the more easy topics about substance use or sexual health. And so we put all of our money, instead of funding each of our campaigns separately at the state level, we started funding one campaign together called Forward Together Colorado. Next example. This ties back to something I said at the very beginning about access to nutrition and making sure children grow up with adequate nourishment is an adverse childhood experience. Sorry, the lack of that is an adverse childhood experience. And we know that that is tied to a variety of health outcomes, including substance use, mental health, chronic disease, and a variety of other things. So across our prevention services division in Colorado, we actually agreed all on the same objective, that even though my funds were for cannabis prevention and your funds were for sexual health and your funds were for chronic disease prevention, we had a major challenge in our state that the state average was only 56% of eligible families on Medicaid were actually signed up for WIC. So we could all try and move that needle. However, it worked in our programs, however that outreach looked. We didn't agree on specifics of how we were going to do it. We just all agreed that changing that objective would be our shared approach for this work. And then lastly, a shared theme. So next slide. Is this is the Colorado Blueprint to End Hunger. And I shared an image of their policy committees. They had a data and evaluation committee. They had a projects committee, a food systems roundtable, food coalitions, food pantry assistant grants, micro grants for food access, healthy school meals for all. This is an example of kind of any type of chicken, egg, or basket in any form. Doesn't matter. We're generally all working towards the same direction. We don't necessarily have shared strategies. We don't necessarily have shared objectives because we might have lower level unique objectives throughout, but we're just working towards the shared theme of ending hunger. And that's going to look a lot of different ways in a lot of different communities all across the state. So that's the shared theme strategy. Next slide. So just one quick reminder before we dive into questions of thinking about those unique leadership, prioritization, true deep understanding of the methods, the management, and making sure we report value back to the funder are all an important part of braiding and layering. Next slide. We're going to share some of these resources with you all. Some have already been put into the chat and a couple more are coming up. Next slide. There's a few more links, so hopefully you'll be able to access these as we move through. And with that, I think we're going to open it up to questions.
Awesome. Thank you so much, Allie. That was such a great presentation. Really appreciate it, especially those examples that you walked us through. That was awesome. And as Allie flagged there with the resources, we're going to pop them in the chat. And if you've attended our coffee chats in the past, you know that we always share out a little resource roundup. So if you don't have a chance to grab these from the chat today, no worries. We will be sharing those out afterwards. So thank you for the wonderful presentation, Allie. So I'm going to get us started with our full group discussion. So I really want to encourage folks, any questions that you have for Allie or things you want to check in with other folks on the call on, feel free to come off mute and ask your questions, pop them in the chat, whatever you'd like. But I'll go ahead and get us started with one question that I have here for you, Allie. So you definitely touched on this, but what are some of the biggest barriers to braiding and layering funds?
That's a great question. The first things that come to mind is really identifying what that common goal is and truly seeing it as shared. A conversation we had in our state health agency was price as a driver for health behaviors. And how could we train, because our tobacco team was trying to talk about tobacco taxes, and our cannabis team was trying to talk about cannabis taxes, and our sexual health team was trying to make sure there's free access to reproductive care. And then we had our nutrition team talking about food prices and location. And really coming down to, okay, price is a shared strategy. How do we build those foundational skills for our partners all across the state to understand the levers to impact price, period? Whether you're thinking price for food, price for reproductive care, price for, like, there might be nuances to it, but can we have shared training? That was an infrastructure strategy for us of, can we build the foundational skill of people understanding how price drives health in communities, and that price is an intervention point no matter what the topic might be? How do we build that foundational skill first? Because then it'll help maybe advance our specific food pricing issues more, a little bit more easily because we've already done some of the background. But that getting that shared conversation, like, no, pricing for food is different. Pricing for reproductive health care is different. It's like, yep. But we're having like an investment issue of getting everyone on the same page that price is an effective strategy. So can we talk about price as an effective strategy and why, and the general research for it as a broad training and infrastructure support first, and then move into it? Some of those, that initial common goal can be really hard to identify at first, or sometimes funders want to see the word of the topic being brought up every time. And so if that first training never once mentioned tobacco, for instance, that could not fly with some funders, or if it didn't mention cannabis, that might not fly with some funders. And so really being aware of what are the limitations, how do you meet those needs, how do you make sure they see the value in it, is another big barrier. And then I think the bureaucratic challenges to shifting money. Colorado was looked at as a model for a lot of braiding and layering work, but to be honest, most of our braiding and layering was all internal to our organization. And more rarely was it cross organization, unless they were all state agencies, because then we could at least move money a little bit better between state agencies. But trying to braid funding into one contract from multiple agencies is just so much paperwork that often it was much easier to focus on our braiding opportunities within the organization. And then in our partnerships outside of the organization, just talk about layering. Like, how about you cover that activity and we'll cover this activity, instead of really trying to get things together into one contract, or paying for one FTE, or sharing one technology across agencies. That was just a lot harder because of the bureaucratic challenges.
Thanks, Allie. This is some great points. So I see a question in the chat here from Chisholm. Thank you. This is a great question. So Allie, how can one begin the conversation of braiding or layering with a potential partner?
That's a great question. Where I've seen some success is first those partners coming together to acknowledge that no one has enough funding individually to tackle the problems that they are facing. And so where are there opportunities to begin looking for efficiencies, or to look upstream, to say WIC enrollment can impact all of our outcomes, or by addressing this one social determinant of health, we can actually impact a lot of the outcomes down the road. And so all of us have these funding for these specific outcomes down here, but if we combine that funding and move it upstream, we might be able to make more of an impact on all of our outcomes. So I think it's really that leadership first across the agencies to say, is there a reason to come together to look at our funds, to decide how we can be more efficient and effective together by creating a shared goal of what we're working towards? And is there buy-in to be able to do that? And then the prioritization, okay, what is the shared goal? What would the approach be? Then what are the logistics and methods that we're challenged with, and moving down through each of those 5 areas.
Great. I think those are some great suggestions for kind of framing up that conversation. So appreciate that. And thanks again for the question. Keep the questions coming, folks. These are great. Got another one here. What are the skills required of leaders to manage braided and layered funds well?
Another good one. I think some of the qualities of that leadership that come to mind, I used to joke when I worked in state government that my superpower was being scrappy. You got to know the system so you know how to work around it. And so that's a really important leadership skill, is actually a deep understanding of funding timelines, limitations, objectives, reporting requirements, and the contracting process, just so that then, as you're talking about what's possible, that you're bringing those a knowledge of the context, the logistics to the table, even though those don't have to be figured out right away, but it's informing how you're talking about what's possible in the ways that we work together, that you even know what other kinds of funding are out there in the world, that you know what gaps there might be. One of the things we found was a system in Colorado completely changed what it allowed, some of the funding strategies it allowed, because it thought no one was doing that work. But then it meant they were taking funds away from their intervention and moving it upstream because they didn't know anyone was funding that work upstream. And so then as we met them, they were from Human Services and we were from Public Health. So as we met them, they were able to redirect their funds back towards the intervention, but we were able to have a much closer relationship. How can their data from intervention move upstream and inform our work on prevention? And then how can we do a better job of the warm handoff when people fall through our primary prevention, catch, where we're trying to keep people from needing the intervention, but that's not always universal and possible for every single individual. So how do we improve the warm handoff back down to them? And so it helped them be more efficient with their dollars, because we began to see, instead of we were over here doing public health work, they were over here doing intervention and human services, we'd be able to see us as doing the same work and just part of a continuum of care together.
Terrific. Thank you. I see a question in the chat. Thank you, Mark. How can you reduce a potential partner's anxiety related to potentially competing for limited funds?
That's a great question. And that, I think, is all about trust building. And I think knowing yourself, your leadership well too, knowing the past, the history, the damaged relationships that may truly exist from the past that you need to be aware of and work to repair where you can. Especially with a lot of really big and governmental public health systems, there have been times that public health let a contract, let time fall between contracts. Like, oh, we're funding this work. Oh, we don't know what we're funding next year. We're going to wait. We're going to decide. We're in the middle of strategic planning. We're not going to put money out. And then they wait a few months later and then they fund something similar. But in that 5-month gap period, you've lost the trust of your communities because you weren't funding them for that time and they lost their staff. Or you didn't follow through in paying them. And so that maybe that wasn't your decision, but that history is there. And so really working to do that repair as an entity with your partners, to know where trust has been lost. When someone did apply for funds, that there was an understanding a different agency would apply for it. And this is where I also think that doing some of the work internally first, how do we braid and layer funds internally when we're all on the same team? Even then the competition can be a little fierce, and a concern that if we put money towards there, are we going to see what we need? And so learning those lessons internally first when the stakes are lower, so that you've done a better job anticipating potential pitfalls across organizations, can be really important.
Great question. And thanks, Allie. That's great. Great advice. A question I have here, what have responses from funders been to braiding and layering funds?
Yeah. There can be a concern of, is my money really necessary to help you do that other work? Since it's shared work, do you really need this money to go there? So making sure that you have the justification, the data to back it up, the increased reach. This is the important of the braiding, maintaining each section of the braids still individual and not blending all of the money, so that you can say the addition of this $100,000 to that media contract for a shared campaign meant we were also able to do what? And you have to think about that campaign, that shared strategy in that way, so that you can report back to funders, this is still vital. This is still a necessary part of creating the entire braid, and not just getting dissolved in. So responses from funders can be highly concerning that way. But when you have their trust and you show the value, it can really be incredible and amplifying of that work to say, we had core violence and injury prevention funding from the CDC, and it was only $200,000 to do like a bunch of different outcomes across the entire state. And so what we did was actually paid for an evaluator out of that work, because it was such a small amount of money, and just like a couple little small things too, right? An evaluator's not $200,000, but we paid for the evaluator to then look at how the state cannabis dollars were being used to achieve some of those outcomes, how these other dollars, rape prevention and education funds, were being used to achieve some of the dollars. And that ended up being this incredible, like CDC absolutely loved it and got really excited by it, because we knew that money was actually not enough to show outcomes across all the different areas they were looking at. So instead, we used it as the meaning making money, the data collection money across all these other efforts to say, sure, that's being funded out of cannabis, but it is impacting traumatic brain injuries over here, and be able to report back to CDC. So they can get really excited when you have that trust and you have the right reporting back to them. But it does come with its challenges if the trust isn't there yet, or if there's a perception that the money is just getting diffused or blended in, instead of truly held individual and accountable for each funder.
Awesome. Thanks for walking us through that. So another question in the chat here, if you have a collaborative relationship with another organization, how could you braid and layer funding for both organizations, or is it possible?
Yeah, I think this is where the braiding can be a little bit more challenging because you're trying to share money across organizations, and where layering might make a little more sense for ease of bureaucratic processes. But an example might be if we go back to that, we want to improve health education all across our community, and we agree that is our shared goal. Your best and you partner organization have the best relationships with pediatricians. And so how can you be working with them to improve the conversations they're having with families, but I work directly with parents in these other ways, or with Spanish speaking parents. So I'm going to do this and you're going to do that. But how can we make sure our messaging is very similar, that we're reinforcing the same thing, that we're driving people to the same website, that we're reinforcing the same skills or talking about it in the same way, so that people are hearing that new information the 7, 8, 9, 10 times they need, before it becomes part of their knowledge base, and might be something that they transition into practice. So how can we make sure what we're doing is both on the same page, but using our individual expertise? So that might be that more layered, where we're each funding a different activity that builds towards the shared goal. But the sharing of money can be harder. That can be a little bit more challenging.
Awesome. Great question. So another one here, what are some ways to ensure the sustainability of this type of funding over time?
That's a good question. I think it is the way to sustain the work as the funding changes, is a way that I'd like reframe that. So that Forward Together campaign that I was referencing prior, as a state, we had a little bit of alcohol money, and then we didn't. And then cannabis money got cut. But at the same time cannabis money was cut, there was a new fentanyl prevention initiative. And so the campaign was able to sustain, but the players at the table helping fund it were much more variable. And so it allowed that campaign much better sustainability over time, where we were more likely to have an impact, more likely to have campaign recognition, more likely to be able to integrate it better into community practice, because of its longevity, without, for cannabis specifically, we had an 80% budget cut when COVID hit. And so any of the cannabis specific campaigns had to disappear. And so it really made a lot more sense to have this non-outcome specific campaign that was hitting that shared risk or protective factor upstream of cannabis, upstream of sexual health, upstream of nutrition decisions, upstream of alcohol, and vaping. And so that shared parent conversations and safe space to have hard conversations with youth, helped it sustain despite each of the partners having different funding levels over time.
That's great. Thank you, Allie. And yeah, thanks for kind of clarifying there that, it can be used to ensure sort of sustainability of particular topic areas more, as a strategy for that. So I think that's great to kind of focus on that. But before we ask one last question here, I just want to invite folks, we always ask if there's something you learned today, something that was totally new to you, a resource, a tip, anything like that, that you really found interesting, or you're going to take away from the chat today and you want to share that in the chat box, feel free. We would love to see that. So while you are pondering that, Maybe one last question I have here for you, Ali, is how do you measure kind of the effectiveness or the success of braided and layered funds? Are there any criteria for evaluation?
A great question. I think the measurement of the success, I think, would be thinking about those five categories. Um, how well did the shared work, whatever that common thing we funded, did it meet that prioritization goal that we set out together? So do all the partners feel that they made, that their contribution to the collective effort helped them with their efficiency? So you can evaluate the partner perceptions of their value. You can ask the funder of their perceived value to say, if I hadn't done this approach with my partners, I wouldn't have been able to do XYZ. But because we layered funding, it meant our reach was like this. Does that still work for you? And hearing the funders' feedback. And then I think the success really is on how well did you set up the process to be able to be responsive to the unique methods and management of each funding source? What were their required outcomes? Did you still collect that data for each of the funding sources? What were the timelines? Did you get yourself into trouble because we didn't have the right person managing the funds, where you didn't use XYZ funds before June 30th and you tried to use them in July, but they ended June 30th? So did we lose out on potential funding because we weren't managing the timelines correctly? So I think it's really going back to each of those five areas and finding a way to assess. Does leadership still support this? Is this still right? Does everyone feel like the prioritization is still meeting our needs, that we defined the goal collectively well? Were there any methods that we missed? We forgot about a measure we needed to be collecting. We didn't use funding in time. The person who is managing the funding, have we made their life miserable as they're trying to navigate this across all these different partners and funders at the table? Can we not keep anyone in that position because we're all coming at them with 10 million demands? And then does the funder still perceive the value? So I think going back and assessing each of those five areas would be the way to really determine the success, because I think each one is important.
Terrific. Thank you. Thank you so much, Ali. And thanks, folks who shared their takeaways in the chat. Those are great to hear. So thank you. And thanks for this great conversation and all the great questions from folks. So I think we just have a couple closing notes. We will be, we will be sharing out all the resources shared today via email. So everything you saw in the chat, we'll be sharing those in our resource roundup. So stay tuned for that and for the recording as well. If you have any suggestions for future topics for coffee chats, we're always collecting those. So feel free to share those with us now, or you can always reach out via email. Our email's on the slide there. And just a friendly reminder, as always, please join our Choices Community of Practice online portal. You can access lots of other resources, including our member directory, and kind of get connected with folks all over the country. So please take a moment to register. It's free to do so. We can pop a link in the chat. Thank you, Stephanie, for doing that. And I also just want to highlight, there will be a little survey that's going to pop up when you leave the meeting today. So we really appreciate you taking the time to complete that. So again, I really want to thank our speaker, Ali. We really appreciated having you come today and preparing all of this great information. I know I certainly learned a lot about braiding and layering, and sounds like other folks did as well. So thank you so much for your time, and thanks everyone. Hope you all have a wonderful rest of your day.